Hi everyone, my name is Shivani. Me, Karam, and Megha are going to present the topic hospital and acquired infections. We all nurses and we know what is HAI. Imagine walking into the hospital to receive a care only to leave with something far more dangerous than you came with. This is what HAIs do to our clients. We are nurses. We know what is MRSA and VRE. As a nurse, our goal is to implement targeted infection control measures to significantly reduce the incidence of these superbugs, improving patient safety, reduce expenses, and enhancing overall treatment outcomes in healthcare system. So why we only choose this to present in front of you? Because this is a growing threat to the patients. These infections cause higher morbidity and mortality rates, making them critical public concern. To reduce this risk, we must provide safety standard and advocate for better healthcare practices and address this escalating problem of antimicrobial resistance. Taking action now is essential to protect lives and make sure to save the future of effective healthcare. You are wondering that why it is a Canadian healthcare issue. HAI have become major concern in Canada with troubling rise in infection. As this contribute to higher incidence and mortality rates, it is clear that urgent action is needed to improve patient safety. So, to ensure patient safety, what we gonna do? Disinfect all the equipments and surfaces with the 70% of isopropyl alcohol and also join in drop-in sessions for KYP development and to get clarifications. Always wear glove before and after contacting with the patient. Use proper donning and doffing techniques for gown to maintain hygiene and prevent infections. So another one is hand washing. Why hand washing? Because it ensures better patient safety and effective infection control and also enhanced healthcare outcomes. This quality improvement plan, what we can get. So the outcomes would be great. Improved infection control compliance leads to the lower MRSA and VRE rates, enhancing patient safety and fostering a strong prevention culture. Ongoing monitoring and feedback drive continuous improvement. There is a saying from our group, compliance today builds safer healthcare for tomorrow.
Evaluate outcomes for infection control solutions. The primary goal is to reduce VRE and MRSA infection rate by 50% within the next year. This will be evaluated using both qualitative and quantitative metrics. The monthly infection rate before and after control measures and track are compared quantitatively is an attempt to reduce infection rate from current level, and staff feedback on adherence to the protocol will be collected quantitatively, and patient satisfaction survey will measure participation of cleanliness and safety, which will provide complete evaluations of outcome.
So we have identified some common barriers like staff compliance, resource limitations, and cultural challenges. To overcome these, we would prefer to train and educate our staff, regular monitoring of the resources, and also enforces leadership support in the hospital sections. It radiates a great impact on patient, staff, and leadership. By adopting infection control protocols, it boosts staff confidence and morale, strengthen the leadership accountabilities, build a positive hospital reputation, enhances patient safety, which fosters community trust and higher care standards.
So let's talk about the sustainability plan. Sustainability plan is plan that is made to sustain the changes that were implemented earlier to sustain those changes. This is a 5-year plan for hospital acquired infection prevention in case of MRSA and VRE. So for first year, we will establish infection control practices with clear hand hygiene protocols, tracking and infection prevention teams. Second year is training and monitoring. We'll expand training and ensure compliance, educate families and improve data training. In third year, responsible antibiotic use and awareness. We will promote responsible antibiotic use and raise public awareness with extra support for high risk hospitals. Fourth year is improvement and collaboration. Assess results, share successful practices, and update training. Fifth year, we will do evaluation and long term change, evaluate overall impact, and make practices permanent and secure funding for sustained infection control. This phased approach strengthens infection control time, ensuring long-term effectiveness and to lower down the infection rates.
Rogers' theory and transformational plan are good to implement in sustainability plan. In Rogers' theory, there are 5 steps. In first, we will educate the family to aware them. In second, encourage to attend workshops. In third, to track infection use rates. Fourth, implication of preventing measures. In fifth, adherence to maintain low infection rates. So why transformational leadership is good? It fosters continuous improvement, clear communication, staff empowerment, and safety focused culture for lasting infection control success.
So here are the resources that are needed to sustain the change. First of all, training. Continuous staff education will help. Secondly, surveillance, tracking systems and audits. Third is leadership. Committed transformational leaders can help. Fourth is communication. Regular updates and education can help. Fifth is collaboration. Partner with health authorities and hospitals can help. And funding. Secure resources for overall needs. By this, the resources can help to sustain this change.